We're live.
We're live?
Yes.
Hey everyone. Welcome to our September Go Live segment, talking all about the gut today. So we'll just give it a couple of minutes, not a couple of minutes, but a few seconds to have people join in. Hope everyone's having a really good day. The sun's out.
Yeah.
It's not Sunday.
It's getting warmer.
Torrential downpour. Yeah, it'll be nice. We had a little glimpse of fall in the evenings, but
I kind of like it though.
yeah. So welcome everyone. Thank you so much for tuning in on our Go Live segment today. We're going to be talking, Dr. Ryan and I are going to be talking about gut health. It's a huge topic that has gained a lot of traction and attention over the past several years, over the past many years. As you all know, we are rooted here, even though the name is Fresh Skin, we've evolved into more of an integrative functional medicine practice. Half of our practice focuses on wellness and functional medicine, and the other half is all about aesthetics and skincare and aging gracefully, is what we like to call it. But today we're focusing on the gut and how the gut impacts basically everything in the body, which is fascinating to me. I personally have had issues with gut, so I thought it might be appropriate for me to sit in here with Dr. Ryan today as we talk about it a little bit. So we get, Dr. Ryan, so many patients that come in on the wellness side. Most of them you uncover gut type of related issues. So how is it that most people have issues with the gut?
Well,
not everyone, but many.
I would say most.
Yeah.
You know, people come in here with more questions than any kind of preconceived notion. They have symptoms that haven't been, that really haven't been addressed at other practices, or in some cases even been dismissed because it's considered normal. It's normal to have reflux. It's normal to have some stomach pain. It's normal to have, maybe some IBS-like symptoms because of different foods that they're eating or their lifestyle or their stress or whatever. So when things become expected, we kind of just learn to tolerate it, and we look for things that can easily fix it, like we take an antacid or like some Tums or Prilosec or whatever it is, just like allergies. You have allergies, you take Zyrtec or whatever, whatever kind of placates you to get you through. But in reality, over time, that continual irritation creates a problem. That irritates the gut lining. We develop something like leaky gut, where individual nutrients, small particles, molecules migrate through the wall, and then it creates an immune response. And that immune response presents differently in everybody. In some cases, it will be IBS, like bloating and fluctuating bowel movements. And other people, it's going to be pain and even things like depression and anxiety. I mean, there's a huge field of neurogastroenterology coming out, and it is all about that kind of sensation, the changing of how you feel and think and function because of the change in your gut. Your neurotransmitters, 70% of your neurotransmitters are in your gut. So serotonin, dopamine, all those things that we treat when we're not feeling well, we're not thinking that we can feel happy, or when we're like you're saying, anxiety and depression, all that kind of stuff begins in the gut. That whole gut-brain axis, if we're not healthy, if we're not absorbing nutrients appropriately, if we're not, kind of being proactive to manage our stress, those things build up and it creates a problem. There's a reason certain nutrients elevate mood.
Well, that's interesting because I have 3 different things popping up right now. So one is, even as I was growing up or even going out with my friends, we got into the habit where sometimes you eat something, you're like, oh, I'm stuffed, or I'm bloated, or you're belching. And you think it's a normal response to feel afterwards, or you get exhausted, you want to eat, and kind of you go into that food coma. But apparently, that's not normal. That's not what should be happening with the gut.
Well,
or the responses that we have.
But maybe it should. It's just, severity. What are the reasons you're doing it and the severity? So if you overeat, you're going to bloat. You're going to feel full. If you overeat certain foods and you have difficulty processing those nutrients, people with things like gluten sensitivities or corn sensitivities, you eat too much of that or too frequently, you'll have some symptoms, and that would be normal. not necessarily acceptable.
Right.
You know, it's not how you want to feel. But food coma is a totally different thing. Food coma goes back to how we have really taught ourselves, and we've worked with really unconsciously or subconsciously to learn how to change the way we think and feel through food. Pretzels, ice cream, chips, popcorn. When we're sitting on the couch and we allow ourselves to be sedentary and we eat a whole bunch of starch, and that alters those neurotransmitters in the gut, it changes the way we think and feel. That's why food coma works, and that's why we gravitate towards that.
So it's kind of like a soothing mechanism.
Yeah,
almost.
absolutely.
That's interesting.
And we may not think about it, but you know, we do. You hear people say, "I need some chocolate." You hear it, and it happens, and people do it, and it's because it works.
Well, I used to have a sweet tooth. Like,
Mm-hmm.
you know, I grew up, my mom would cook and everything from scratch and bake, and we always had something sweet. And I remember, obviously, I have a whole wellness story and journey, and there's lots of parts to that. But I remember always craving sweets, and I'm a very big starch person or carb person. And I used to eat a lot, which was interesting because I'm kind of smaller frames, but I would eat. And now, after I've shifted all of that, I don't need as much of the volume of the food, but it's again the content of what I'm eating.
Right.
And I don't have that sweet tooth anymore. It's really, really rare. So, but obviously there's a transition. But yeah, it's pretty fascinating because when you're doing this and it's a daily process, you don't really think about the food, or it's like, you know what, I don't have time this week, let me just grab this. Or, you know, we also live very busy, fast-paced lifestyles too. Let's talk about, you touched on the gut-brain access, there's gut heart, there's even dental, when people have a lot of dental disease.
Mm-hmm.
You know, dentists are now saying that that's rooted in the gut as well. So all of this is fascinating when we talk about neurotransmitters. But let's talk about just leaky gut a little bit. You know, when I first heard that term years ago, that you have leaky gut, I was like, what do you mean I have leaky gut? Like, how are particles getting through into other areas of my body? Like, how is that even possible?
Mm-hmm.
And so when you were talking earlier, there's an early onset, and then it's something that becomes kind of like normal. But for some people, if they don't address it, it can truly become severe, where you almost can't reverse it or modify it if it gets to a certain point. But there is much in terms of healthcare that we could prevent, or we can reduce the severity of, or we can treat, cure, you know, reverse certain elements of. But it's definitely a mystery and a puzzle. But what is, when you say, you know, it can come through the lining, what? Like, how does that?
Leaky gut is not, some people would say, well, it sounds like an ulcer, there's a hole, there's a wound.
Right.
It's not really like that at all. There's a plush lining of your, you know, of your intestines, of your gut. That lining is where nutrient absorption takes place. That lining can get eroded when there's chronic inflammation or irritants that are that the gut's continually exposed to, and this junction of the cells that make up that lining starts to pull apart a little, and you get these tiny little gaps. And so if you picture like small protein molecules, carbohydrate molecules, fat molecules that migrate through, and I'm not saying like you're seeing a piece of steak migrate through.
Right.
It's not what it is.
Well, that's what I was thinking originally.
No, it's
like,
almost, think of it more of like an extract,
yeah.
right? And as it comes through the body, and it migrates through the lining's thin. I mean, you've seen what an intestine looks like. I mean, it's stretchy and it's thin, and it's not a difficult thing to understand how it would migrate through once you realize that if that plush lining isn't there and all that's left is the intestine.
Really?
Yeah, I mean, it's going to get irritated. It's going to create disease, and depending on the person, what your immune system is like, it will dictate what type of response you have. Some people are going to have more gut-like responses, but other people, where their immune system is overactive, like an autoimmune case is, you might start seeing eczema, rosacea, psoriasis. You might see these other presentations that were never really correlated before.
Acne.
Yeah. But now all that data is very clearly pointing towards, wait a second, something, they were onto something. We just couldn't figure out what it was. Because 30, 40 years ago, people talked about leaky gut and it was dismissed. And then it came back kind of in vogue. We talked about it maybe 20 years ago. In the last 5 years, it's valid. It's just been validated. You have university gastroenterology groups doing studies proving that this is actually happening. So how do we prevent that kind of inflammation? And how do we even know if there's a problem? The issue that I see is that what you said early on is that the gut affects everything. So no matter what, if someone's coming in with a mood issue or obviously a gut issue or an immune issue, I first ask them questions. What's your typical diet like? Tell me what you eat over a 3-day period. What do you like to eat? What are your cravings? And what's your poop like? How often do you go?
Well, that's what I wanted to do is talk about poop. But before that, you just made a comment when you were asking questions. When patients do come in, we have a very thorough intake process, and that the visit, essentially this wellness visit, really begins with the paperwork before you even see Dr. Ryan in terms of the questions that are asked. And it's funny because, again, we're in that fast-paced society and everyone's like flying through their intake process, but there is so much information that Dr. Ryan, Dr. Josie, whoever you're seeing can gauge from that. There's clues. There's really, really important clues there that we can see before the visit, so then in the visit we can dive in a little bit deeper. But so it's interesting. So let's talk. I want to talk about how can you tell if something's off? Like, when should I go see somebody? And let's talk about poop. Like, is it true that you should have the S-curved or S-shaped poop? And should it be clean poop? Like, how often? Should you have corn kernels in your poop? I mean, let's talk about this.
Okay, so you should not have undigested food in your poop. If you have undigested food in your poop, yes, there's an issue. Mm-hmm. It's some form of malabsorption syndrome, enzyme deficiency. There's definitely something to be considered, and we can look at it. We can run tests. We can literally run stool tests. We use a lab that uses microchip technology, is very advanced. We can learn everything from the type of pre and probiotics that are in the gut, what types of enzymes are deficient, what types of disease states can either present or will present if this disease progresses, and if these deficiencies progress. There's a lot we can learn from poop. But to answer your question, there should not be undigested food in your poop. Really, I would tell you, it's consistency that matters most. If you know something's wrong, if something's changed, mm-hmm. and before it felt okay. If something's changed and it's different, then you should pay attention to make sure that it's temporary change. Okay. Because
sometimes, for example, we go through periods of stress, like there's a move or something's going on. So it's okay if it temporarily alters your poop, or you kind of know it's stress and there might be something going on. But
right, that would be a different, exactly like you said, a different thing, because mm-hmm. there's a reason. The small bowels, you have smooth muscles. Smooth muscles will spasm in times of stress. That's kind of one of the symptoms of IBS, where people feel cramping. Mm-hmm. That's expected. You don't want that to continue. Anything that becomes chronic is something that we should be looking at. But if there's something that has been chronic where I always feel bloated when I have popcorn, or I always have loose stools when I have blueberries, that's generally more of like a food sensitivity issue and less of I have bowel problems.
Right.
Now sometimes it's a bowel problem, like diverticulitis if you have popcorn or seeds. There's a lot that really goes into, is there something wrong? But really, when to notice is, does it hurt? Is it always like that? Is this something, or the opposite, is there something new? Are you only going to the bathroom once every 4 days? Because even though
how often should you be going to the bathroom? I mean, I know everyone's different. So
I was going to say, shouldn't is questionable, but
yes.
It would be healthy to go at least once a day.
Mm-hmm.
It would be healthy for some people to go 2 or 3 times a day.
Right.
It's probably unhealthy to be going only twice a week. But we see a lot of people that only go about twice a week. But different diets create different patterns.
Yeah.
And for the most part, people don't bother even discussing it unless it's something that's abnormal to them, or until they're talking to someone else and they're like, well, I go every day, I'm like clockwork every morning, and someone else is like, well, I do once and it's normal, and then like the next 3 times that morning they're bad, and you're like, wait, you go 3 more times? By what time? And then it's a different conversation. And
That's funny.
yeah, so I think that's really where it comes up, where people say, is there something wrong? Like, how will I know?
Yeah, it is hard because everyone, like we tell people here too, you know, sometimes we'll take a look at what our friend did or family member, and you know, that's how we try to pull information and learn and educate ourselves. But not everyone is so different. Every single individual's health profile is a unique profile. It's like a fingerprint. There are no 2 fingerprints alike, and it's the same with the body.
Yeah.
So sometimes we have to do some investigative work. Sometimes it's really just about learning and educating yourself. So there's a lot of facets in, you know, wellness consultation and learning about all of that.
Well, especially when we do, so that one lab I was talking about, the Vibrant Gut Zoomer, when we run that Gut Zoomer test, that clearly displays the difference between one person and another. Same thing with ALCAT food sensitivity panels.
Right.
There is never the same. They're never identical.
Yeah.
It's not like, well, you're B12 deficient and you're vitamin D deficient, and you find the next person that's also B12 vitamin D deficient. That's pretty expected.
Yeah.
But when you see the differences in pre and probiotics and the different enzymes that people, you know, create and or are missing, the different food sensitivities that people have, even in the same household, you get 2 different people running food sensitivity labs trying to follow anti-inflammatory diets.
Yeah.
It's impossible to shop. It's impossible to cook. I shouldn't say impossible. It just becomes a very different kind of interaction and a different planning.
It's a different process until that becomes the norm, because eventually it will become the norm. It's just there's always
it's a learning. It's transition. It's really learning about what you can feel like, because oftentimes people don't realize how they feel is a symptom.
Right.
They don't know that was a symptom because it was always there. It's not until it goes away that they're like,
wow,
oh, I had no idea. Yeah.
It is interesting because sometimes, you know, I've gone through these tests as well, and you know, you've been the one to present the results to me, and you know, there's times where you kind of, it's just like, well, what do you mean this is going on?
Yeah.
You know, and it's
I'm
just
not
like,
doing this.
how am I going to do this
all the time?
When am I, you know, and it is because it's personal and it's scary, and it's just like, but I will say that going through that, you know, there are some elements that take a little bit of time, and there are some elements that actually don't take a lot of time. It might be one, you know, if you're eating avocado toast every day and you have a severe sensitivity to avocados, you're going to feel quite different if you cut that out after a few days. So it just varies, but it did, after I did those trains, like I said, the sweet tooth, and so many things had changed and evolved, and even I have Hashimoto's, I had hormone imbalances, so there were a few different things going on, and all of that balanced out. And I was a wreck in my 30s. Like, I was up and down. We just couldn't figure it out until really I was very lucky to be working with you and Dr. Josie and learning myself as a staff member. But it was life-changing for me. And now my labs have been optimal and, consistent for many years when it comes to thyroid and all of that. So it is very fascinating. And I want to talk a little bit more, but we are limited on time. But before we end, you had mentioned something about probiotics, and right. I remember in my 20s, I'm very regimented, so I would take, I'm going to say this was my experience, I took Women's One a day, right? Mm-hmm. That was a supplement, it was at Target or wherever I was shopping, and I was very religious in taking that, once a day. And then what I learned after all of that is that it wasn't really being absorbed into my gut. Like, it literally just wasn't being absorbed. So if you're taking something, you might think that, hey, I'm taking a multivitamin, I'm doing this, I'm doing that, but if it's not being absorbed by the body, and if your gut lining or your gut is off and it's not working for you to grasp the nutrients so that it can support your body, it's very ineffective.
Well, let me just
and the
say
probiotic, yeah.
Over 50% of people taking multivitamins are still nutrient deficient and nutrient deprived. And some cases it's because the vitamins they're taking are poor or poorly made,
Right.
Not bioavailable for whatever reason. But the vast majority of it is because the patient themselves have some form of malabsorption syndrome
Right.
and don't know. And because that's a common occurrence here, and we pass it off because we can feel better by taking something else to suppress the symptom.
Right.
So if you realize, I don't have time to deal with this right now, or I don't know, you don't know enough to go see somebody, you just kind of suppress the symptom. But now, when it comes to things like probiotics or other enzymes,
Well, I thought
you read
probiotics
about
are
it.
just like probiotics. I didn't realize that there's a ton of variations in probiotics, and I could be taking one brand of a probiotic, but I don't need that in my gut. My gut
Right.
needs X, Y, and Z. These other four
Bacteria.
Yeah.
Traits, yeah.
So thanks, but so anyway, so that's where it's off too, where I was on a probiotic. But anyway, there's so much to always be talking about. We hope that this was. Did you want to add to that, or we could keep going on?
Yeah, we can go on,
Yeah.
especially with gut bacteria.
I know.
It's a huge. It's billions, literally in the billions of bacteria. So it's the most. It's the largest living organism in our body. It controls almost everything. So,
Yeah.
literally everything. It controls everything that we do, think, feel, absorb, because it's responsible for the health of our gut. So you can't just take one probiotic forever,
Right.
because it changes all of the other gut bacteria based on that balance. So
Well, even other
really-
supplements, you
yeah.
don't need it forever. It's also seasonal. It's dependent on stress
Yeah.
levels. There's just so much. But the good news is there's education, there's help, there's resources, and there are things that you can do to really help either, heal, reset, give you some more control in your life, and actually make you feel so much better. And so that's what we do here, what we're very passionate about. Again, on the aesthetic side, but also on the wellness side, is just living optimally, aging gracefully, living optimally, feeling your best self. And what is that for you? And we hear it at the desk with concierge. Patients will say, I literally didn't even know that was a symptom until it went away. I feel so much better, So anyway, so hopefully this was able to shed some light for you, that you have some things to think about. And that if you feel like something is off, definitely seek out a provider that understands the microbiome, the gut, someone more functional, integrative based, who can take time to talk to you about what it is that's going on. If you're in the area and interested, we'd love to have you here as a patient at Fresh Skin Medical Spa and Wellness Center with Dr. Ryan. Thank you all so much for joining us today and taking the time. Stay well, be happy, and take care.
Bye, everyone.
Bye.